the future of healthcare is outcomes, and everybody around us is getting paid for outcomes and for data, and except for DME, we're still getting paid a fee for product, fee for service. So, but I knew that one day that was going to evolve, that was going to change.
How many DME providers are you guys working with these days? How big have you guys grown?
We've got about 150,000 patients in our platform. In that we've reduced hospitalizations by 60+%, avoided probably 80,000, 100,000 hospitalizations.
How does being a pastor kind of influence your life as a CEO? Is there crossover?
Yeah, it influences every part of my life, right? Is that I'm a follower of Jesus. It's cool to see how if you bring those two things together, because if you're a pastor or a follower, then it's who you are. It's not just something you do.
All right, we are live. We have Zach Gantt on the Claim to Fame podcast. Zach, thanks for coming on the show today. All right, we are live. We have Zach Gantt on the Claim to Fame podcast. Zach, thanks for coming on the show today.
Thanks for having me.
Welcome,
Awesome.
Zach. Happy to have you.
Cool, man. So for anyone who doesn't know who Zach Gantt is or Encore Health, can you tell us a little bit about you and a little background about your company as well?
Yeah, so respiratory therapist by training, been a DME my whole life. My family, my dad and my uncle, both respiratory therapists, started their first DME the year I was born. So I grew up in the business. Most kids rode around on bicycles. I was popping wheelies on wheelchairs and fixing concentrators by the time I was 10, transfilling oxygen by the time I was 12, and doing deliveries when I was 16. So I grew up, I did every job in DME pretty much over the years. And then about 10 years ago, we started Encore. When I was on the DME side, I was with a company that they came to me when competitive bidding first came out, and they said, hey, we want to get away from competitive bidding and find a way to do something different. And so I've built an outcomes program for them. And, it was, people always say, how did you grow so quickly, or how did it become so successful? But it was timing, and it was a lot of luck and a little bit of skill. And so we built a program that took us from 10 counties in Tennessee to 26 states over 2.5 years. We went from 30 ventilator patients to over 5,000. And then we kind of leveraged that to go into payer contracts. And we were one of the only DMEs in the country that were going out doing contracts with payers to pay us for respiratory therapy services, not just DME. And so when I started Encore 10 years ago, really the idea was I felt like we were onto something, and that we had done something that no other DME had done at that point, or maybe one or two others had done, kind of leverage the DME and the outcomes around DME to start telling a story about how we could better take care of patients and get paid for data, get paid for outcomes. So it felt like we were onto something. And I started Encore 10 years ago with this idea that the future of healthcare is outcomes, and everybody around us is getting paid for outcomes and for data, and except for DME, we're still getting paid a fee for product, fee for service. So, but I knew that one day that was going to evolve, that was going to change. And so we started Encore with this idea that if we built a tool that providers could use to manage patients, collect outcomes, tell the story. Most of the time, DMEs do a really good job taking care of patients, but they can't prove it. Right? There's no way to prove they reduce hospitalization, or prove how great their clinicians are. So we wanted to create a way that you could prove that, and then go tell the story to an insurance company and show the value of HME, show the value to a CEO of a hospital. And so we built Nexus, our platform. And over the last 7 years since it launched, we've been, as we were talking about before, Alex, offline is kind of like the tipping point process. So we've been out here saying for years, hey, this is coming, this is coming, this is coming. And we got some early adopters. We got some people that said, yeah, you're right, outcomes in the future. But it wasn't a lot of buy-in for years. And I tell people all the time, we were probably 5 years too early to the party, but the party now has started to show up. And if you look across the industry, everybody's starting to focus on data and outcomes, and how do we sell to payers, and how do we get in network with people that we're not in network with. And so it's all of a sudden become more important to collect data. And we've been doing it for a long time. So we've got probably more respiratory data than anybody else out there.
Awesome, yeah, data's
Zach.
been kind of, sorry, Wayne, I was just going to say real quick.
Oh, you're good.
Data has been something we've spoken about on previous podcasts, and how they say like data is sort of like the new age oil, or, for a lot of tech companies. So would you say that you're kind of more in the space of like would you consider yourself more of like a data company at this point, or more a company that serves DMEs? How do you How do you consider yourself?
So we're a SaaS product, but also have, service line that goes with that. So we have a software that we license to DMEs if they want to do it themselves, and that's Nexus. So if you've got your own respiratory therapist and you've got your own team and you just need a tool to track everything in, then we license you software in a traditional SaaS model. And then we come alongside of you and help you along the way. But we also have what we call our respiratory division, which is where we actually staff respiratory therapists and we do outcomes models for DMEs. So if when you came to me and said, hey, my DME's doing good, we've got plenty of sales, but we just clinically, we don't have the manpower, we don't have enough people, or we just don't know how to do it yet, then we'll come alongside of you and do it for you until you're ready and then transition it back to you. So it's almost like a subcontracted play, but it's not just a staffing service. It's we are running our own software for you, collecting the data for you, and creating the outcomes for you. And then you still have the power of all that data to go present to the docs. They never know that we're kind of in the background doing the visits. So we had kind of two different models. One is I license it to you, you do it all. The other one is we do it together and we do a lot of the heavy lifting for you, but then you still have the same message to go out and sell.
Gotcha.
So is
So
that
it's
like
kind of
white
like,
labeled?
Both actually. We've got sometimes it's white labeled and sometimes it's a transparent kind of model. So we've got some very large customers that you would never know that Nexus is the engine that's running their whole operation. But the more common model is that the large provider or mid-sized provider uses Nexus. It's their tool. They're selling Nexus. They're selling it as, hey, you want to use this because the power of not white labeling is that you've got all of our data to lean on. And we published a lot of the data in large peer review journals. So we've got all this clinical credibility and scale. So white labeling is almost a disservice to yourself because you can't lean on the national data that we have and published data that we have.
gotcha. So it's kind of like there's a do-it-yourself version and a done-with-you version, but either way, you can leverage the data with to ultimately try to get these payer contracts. If I'm trying to explain it back to you like I'm five, is that correct?
Yeah. And maybe not even payer contracts. Some DMEs don't even want to do payer contracts yet. They're not there yet, but they just want to grow their business, right? And so it's an organic growth engine, if you will, when you have a relationship with physicians where you can say, look, I'm part of the solution and I'm not just bringing you lunch or bringing you some pins, but I'm bringing you solutions, then you get more business, right? And so we've seen providers lock up entire pulmonary groups where they eliminate the competition in most cases, or in a lot of cases, completely because they say, I want every patient who gets this device to be a Nexus user. And so we've had docs that even put in the order sets in their practice that ventilation with Nexus or airway clearance with Nexus. So when they write the script, it only goes to somebody using our software.
Well, that's really interesting. I can definitely see the competitive advantage there. It's like a whole white glove service and has the outcomes to go along with it.
Yeah, exactly.
How many DME providers are you guys working with these days? How big have you guys grown?
We've got about 150,000 patients in our
Wow.
platform.
Whoa.
And, in that we've reduced hospitalization by 60+%, avoided probably 80,000, 100,000 hospitalizations. So the pretty big scale. We're all 50 states. We're working with two of the four top nationals and then a lot of the regional players. A lot of times, our sweet spot, obviously we love working with everybody, but our sweet spot has been some of the dominant regional providers that say, hey, we're already good. We just want to prove it or we want to lock it in. And so that's been our sweet spot. But now, to be honest, with the NCD and with the times that are changing, our struggle has gone from, fighting for the business to keeping up with the demand for business. And so, it's in the past, we've always been out here saying, hey, we need more business quick, trying to grow as a startup, as a smaller company, moving to mid-sized company. Now it's kind of coming to us because of the new NCD around ventilation. Everybody has recognized, hey, I don't have a solution to be able to manage this. And so we need something. So people are coming to us. Plus we actually just got a deal with a payer down in Florida. So it's not been announced yet, but it's public now. So we can announce it where the state of Florida, we actually got a pilot in play in Florida. It's called the Encore Healthcare Disease Management, COPD Disease Management bill. So we got a bill in play where basically we're getting paid to pilot a project to see if we can save the state of Florida money in through our DME partners and through the Nexus software. That's going to be small pilot for the first year, expand after that. But again, our data paved the way for us to go have that conversation, right?
I feel like, at least to my knowledge, Zach, you were definitely one of the earlier ones in DME. And I think I saw you speak on a panel. I don't know if it was MedTrade or HME Business Summit with other companies now that are merging or that are doing this. And I think they've raised tons of money to do what you've been doing, like bootstrapping from the beginning. So I always loved your story, and anything you'd like to share around that. I can't remember which panel it was, but I know you were giving a lot of good tips about selling to these payers what you guys are offering and the savings that come along with it.
Well, yeah. So, I came up in my family's businesses where they never took a dollar of investment money. I switched over on the DME side. I was in a venture capital funded DME that was, high paced, and we ran the business off of a forecast. And it's a different style. I'm a people person. I love people and employees, just taking care of employees. And so I'm just not a big fan of the high pressure venture capital world where you got to make decisions about money versus about people. And I'm also a believer and I'm a pastor as well. I don't know if you guys know that, but
I
I'm a
did
pastor
it.
at church
That's awesome.
and do a lot of ministry, do a lot of recovery stuff, help people coming out of addiction. And so
Wow.
I just love people, man. And because of that, I said from the very beginning, I'm going to bootstrap this thing as much as possible so that I always maintain control and that I can do the right thing no matter what. And even, our motto from the beginning, everybody that works for us hears us say it all the time, and it's kind of cliche, but you do the right thing, the money follows. And we've proven that that is the case, that, we've done a lot of things to take care of people, take care of patients, take care of employees. And because of that, I feel like we're seeing this success from it now. But I think, the to your question about kind of bootstrap versus some of these companies I was on the panel with who've raised, $100 million and are going after the same kind of models as we are. I'm a DME guy too. And so to go out, some of these models that you see out there today, they're going to the payer and kind of forcing the hand of the DME. And that's, that model works and they're doing really good at it. But we said from the beginning, hey, we want to come alongside DMEs and help kind of raise the tide in the industry of how do we together collectively, track more data, have more outcomes, tell a better story, but not force the hand of the DME to make them, work with us. And so I think, the interesting thing about that panel that you're talking about is we were up there with people that are doing some amazing things with big amounts of money. We bootstrapped the whole thing, but we also created such a deep relationship in the industry, and we appreciate and value that relationship that we believe if we're not coming alongside of DMEs and helping them to do a better job managing patients and get to these conversations with payers instead of kind of skipping over them and then forcing their hand to work with a payer.
That's great. I would definitely say that you're probably the first and only CEO pastor that I've ever met. So that's super interesting. I'm just curious, how does being a pastor kind of influence your life as a CEO? Is there a crossover?
Yeah, I mean, I don't believe in the whole concept of leave politics and religion alone at home
Mhm.
out of the conversation. I leave the politics out, but not the religion part. But yeah, it influences every part of my life. Right? Is that I'm a follower of Jesus, and so everything I do, part of being in business is that I feel like that's part of the ministry. Right? Is part of being a follower of Jesus and being a business owner is I have influence and I have the ability to love people that work for me, that work with me, that are partnered with me. And so it's interesting that I'm very outspoken about my faith. And because of that, I find that most of the people that I've knew my whole life that are in the industry are followers of Jesus and they just never mentioned it, And so it's cool to see how if you bring those two things together, because if you're a pastor or a follower, then it's who you are. It's not just something you do, right? And if it's who
Yeah, I
you
think that
are,
the ideologies are good regardless of what your background is or religion. I think the ideologies is like, everyone should, kind of love each other, work together, make a positive impact. And it looks like you're doing that, right?
yeah.
Going back a little bit, I know we were kind of speaking about this earlier. It sounded like you were pretty much like an early player in the space before anyone really even knew that there was a problem or a solution for what you were doing. Would you say that like there was a moment when you maybe realized that there the model wasn't working, or we have to do something differently, and how you felt about that.
Yeah, I guess it goes all the way back to when I was a teenager. I was watching my family in business, and I watched them pioneer a bunch of stuff. And so that's where I kind of got this entrepreneur mindset of when there was a rule or regulation or there wasn't a billing code. My father and uncle, they started the first 4 ventilator programs in nursing homes in Tennessee. So we were doing home ventilation. Back then it was all invasive ventilation. They saw a need that there was this middle space of between patients in the hospital and home, that there was this kind of missing space that needed to have care. And so instead of saying, well, I wish there were those rules and regulations or reimbursement for that, they just pioneered the way, and they went to Medicare. They went to the governor. They figured out a way to create a reimbursement structure. They wrote the rules for Tennessee, and then later they wrote the pay for performance program model that's in Tennessee. And so I kind of grew up watching that and recognizing that instead of when you hit obstacles, just change directions. The mindset was always when you hit an obstacle, just find a way over.
Mm.
And so I took that with me in everything I've done in life, and been kind of a never quit kind of guy. And people used to tell me I was crazy because when I took that into the DME world, what happened is I was going after payer contracts as a DME. And I remember we probably talked to 90 payers before I got one to say yes to paying us for respiratory services and something that was outside of the traditional billing codes. And people always said I was crazy because no matter what, I never wavered in my pitch or my direction. And I said, look, this is going to happen. Somebody's going to believe in us. Somebody's going to do it. And so I traveled around the country for like a year talking to people that kept saying, no, 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 no. And,
You
or they'd
manifested
say,
it.
yeah, or they'd say, this is a great idea, but we just don't have time to do it. And so finally we found somebody that said yes. And then after we got the first yes, it was like one after another, after another. And so I kind of had that same mindset when we started Encore, that if you look at our vision from day one, our vision was to build into the DME industry a software platform for outcomes, to get to the C-suites of hospital systems and to ACOs, and then to get to the payer. And in the process, to work closely with the DME, be tight knit with them, and help to bring them into those conversations. And so if you look at what we said we we're going to do day one versus where we are now, it hasn't wavered at all. And even though we came up against opposition, people told us we were crazy. I mean, people have said there's no way this is going to work because there's no billing code for what you do. And it's just DME. They get paid for boxes, not for outcomes. And so, early on, that was kind of the conversation. And then people started saying, maybe you're right. We kind of see where the industry is going this direction, but we're not willing to invest in it. And then now it's a lot of those same people that I talked to 8 years ago are now reaching out to us saying, that thing you told me a long time ago, you were right. We need to get in the game. And so I think it's been interesting to see that when you just have consistency and the messaging stays the same, the vision stays the same, it's like when you do that, you create the pathway for success. But so many companies, what happens along the way is they get opposition, there's no adoption, or you're venture capital funded and you run out of money. And so you just don't get to the point where you can see the tipping point. And we had the benefit of being bootstrapped, also the struggle of being first bootstrapped, but it allowed us to ride this thing out even longer than a venture capital funded company would have, until we got to the point where we actually did see a tipping point.
Yeah, it's interesting. It feels like, and I feel like we have a similar story at Nico Health. We were bootstrapped for a very long time, but it's like that middle piece that's like long, boring, monotonous, tons of rejection is actually where all like the brick by brick growth is actually happening, and then the success comes. But it's that long, boring middle part that gets you to the success. So I love that. It sounds like you've knocked on a lot of doors, gotten them shut in your face, and you've been in this population health for COPD space and dealing with vent patients for a long time. Of all these people that you met, what do you think most people, even like industry insiders, get wrong about this population of patients?
That's a good question. I think that the challenge is, and really, you think about what we do. It's not like we have some kind of magic bullet. We just took, how do you provide really good respiratory care? And we put it into a package and standardized it, structured it. And then with that, we created this reporting, right? And so I think I don't know if there's a lot of misconceptions, but I think the idea of this patient population is hard to manage and they're too complex. I mean, there's so many DMEs that don't get into the more complex respiratory patients for various reasons. But if you had systems and structures and a roadmap, it'd be a lot easier to do. So I think oftentimes the misconception on one side is this is too hard. I can't do it. We don't have the manpower. Those things are all things that we can help you overcome. On the other side, you've got the NCD that just came out, which has created pandemonium, panic in a lot of companies. Other companies, have embraced it and said, well, at least now we've got direction. And so I think it's interesting to see how different the market is depending on who you talk to. I mean, I heard the other day there was a large company out there that increased their forecast by like 40 or 50% because of the NCD for ventilation. Wow. And then I heard another large national who decreased their forecast by 50% because of the same NCD. And so I think there's these wide swings in what people think is going to happen in the industry and what direction they think it's going because of some of these things.
Yeah, going off of that, where do you see respiratory care heading over the next 5 to 10 years, especially with AI, telehealth entering the space?
I think that the future is bright. Now, the challenge that we have in respiratory care is that there's a shortage of respiratory therapists. And there for a while during COVID, the number of respiratory therapists going in the field went way down because people saw all the negativity, didn't want to get in. Now that's going back up, but there's also a ton of respiratory therapists retiring. So what that tells us is there's not going to be enough respiratory therapists to provide the care. So my strategy for years has been, we know that's coming, right? It's like, we know the train's going to go off the tracks if we keep doing things the same way and expecting a different result. So why wouldn't we adopt technology and telerespiratory and telemedicine and AI? Because that is how we care for more patients and do it better. And so our whole strategy has been around convincing people that just because we go to remote care and to technology enabled care doesn't mean the care is worse. It oftentimes means it's better and we're going to have better outcomes because it's consistent and it's not just reliant on how good this one person is, right? And that's what we see across the industry today is most companies' respiratory program is only as good as their respiratory therapist or their respiratory manager. And when that person leaves or retires, then the program tanks, right? And so if you create a technology-enabled solution, then that means you've got a level playing field. And no matter who comes in or out, yes, you're going to have some therapists that are better than others. But if you've got this level playing field that says, no matter what, I'm going to get at least this kind of result. And that's what structure does. That's what software does. That's what, bringing in technology does. So I think it's the idea that if we don't evolve, then we get left behind. And if you're not ready to change in this world that we live in, especially healthcare in the last 10 years, if you're not prepared and in front of the change, then it's so easy for us to get left behind or get in a position where, now you got to bring other people in that provide respiratory care because there's not enough respiratory therapists. So I think the future of the next 10 years is that we're going to see more tech-enabled solutions. We're going to see more AI solutions, more telemedicine solutions. But I also think that the evolution that's going to happen is that we're going to have a lot more patients that we have to manage. I mean, care is going to the home. You got the baby boomers, you got all these things coming, and you've got a decrease in respiratory therapists. So to be able to manage that process and do it right is going to take some focus and some strategy. And I'll say that strategy oftentimes in DME, the problem with DME that I've seen my whole life is that we're always focused on what's right in front of us, right? Like this rule changes, let's focus on this. Or this is coming in 6 months, let's focus on this. But we got to start as an industry. If we want to be successful, we got to start being more strategic, right? And instead of not changing billing softwares because it's going to be painful for the next 6 months, let's think about what happens if I'm 3 times as big in 3 years from now, and I'm still dealing with the same problems I'm dealing with today, right? I mean, I'm missing the forest for the trees. And we see that all the time is that people have those conversations of like, they're so highly focused on the problem right in front of them that they're not focused on how do I get out of this problem and be successful in 3 years from now. So I think as an industry, we got to be thinking strategically, and we got to be thinking about if I'm making software decisions, it's not about how do I keep the work down for the next 6 months. It's about how do I thrive in the future, and how do I have the most, modern technology out there. And I applaud you guys because, we work with a lot of software companies, and our programmers say all the time that if everybody could just be like Nico, then life would be easier, because your integrations are so easy and everything's so easy to work with. And it's just so much, just building things together, and integrations has been such an easy flow. So our programmer, even though I don't even know that we're completely connected at this point, but I think he tells me about once a month, can you find more companies to partner with like Nico? So it just goes to show that you guys have a modern platform, user friendly, and to me, how do you continue to operate on systems in this day that are 20, 30 years old, because it's so clunky. And I've experienced it myself so much, is just using old technology is clunky, and it's hard to do. But modern software like what we have, what you guys have, makes life so much easier. And the changes that can happen to it, it's not like I'll put in a request and, in 3 years you might see something. It's pretty quick when you've got nimble teams like we do. And so it's cool to see that as healthcare changes so fast, that companies like ours, who are smaller but also so nimble, can adapt with the change and be the first to market and have the competitive advantage.
Yeah, absolutely, Zach. And one, I appreciate the kind words. I couldn't agree more. We're very big on, one, making it easy to do business with people like yourself, right? My belief is, like, someone like us who's the core platform, you need to future proof that part of your business, because there's going to be the Encores of the world, the Nexus of the world, whatever the next wave, whether it's AI, to connect to your core platform. And there's a lot of limitations out there with DMEs that we work with. And, awesome vendor partners like yourself struggle. Like, there's human handoff sometimes between these systems that today shouldn't exist, but in 5 years, you should definitely be thinking about that. You can no longer afford to, like, solve problems with bodies. It used to be okay saying, hey, you know what, I'll outsource someone to rekey it from here over to here.
Yeah.
But one, you're throwing a body at it, which if you outsource it will be cheaper, but there's still errors that are going to happen because they're all humans at the end of the day. So we're like big believers in having an amazing hub and make it easy for guys like yourself, who are the amazing spokes, to actually do what you need to do. And at the end of the day, it's all about the outcome. So if you can make it easier for, awesome guys like yourself to connect, that's definitely the wave of the future. So I always tell people the same thing. Like, there's a lot of wrenches being thrown at you today, but you still need to look 5, 10 years down the road and try your best to future proof your business, or at least start thinking about it.
Yeah. Got to be strategy focused. And,
Yeah.
I remember when I was growing up, my dad and uncle, their first DME that they started, they had a business plan on a napkin, and their whole plan was they're going to make $2,500 a year in extra beer money. And that napkin is framed here in our office, actually.
That's awesome.
And so that was their whole plan. 25.
Yeah.
And that, my dad actually convinced my uncle to move from Charlotte, North Carolina to Livingston, Tennessee for his cut of $2,500 in extra beer money. They started the DME out of their garage. But in those days, in DME, my point is, you could make money despite yourself. Like, even if you didn't know how to operate a business, you didn't need an MBA. You just needed to know how to deliver stuff and put in a bill. But nowadays, you need to be business savvy in this industry to make it work. It's the margins are thinning, and just the strategy of how you operate. Like you said, it's every single day that we see the idea of, I'll throw a spreadsheet or a person at this, and then I'll solve it. And yes, you'll solve it today, but in 6 months, when you grow 10 times bigger than you are now, hopefully, then that same solution now becomes so cumbersome that you need people and data scientists. That's what I ran into when I was on the DME side and did all this. I had a team of data scientists and LPNs and RTs that were just collecting all this information, putting it into spreadsheets, and then pulling it out in reports. The same thing my software does today. I had a team of 10 or 12 people doing that when I was on the DME side. And so the whole idea, the mindset shift, and I think we're seeing it more and more. How do you start to outsource things? How do you start to solve problems with technology And I think that probably in the last year, we've seen it 2 years more than ever in this industry with AI coming in and with automation coming in. People are starting to recognize that it's not just one person who's, I tell people I felt like John the Baptist shouting in the wilderness for a long time because I didn't feel like anybody was listening. But we were like, hey, this is coming, this is coming. And I think you saw the same thing with some of these AI guys that a couple of years ago at a conference, you might have one. Now you've got all these automation people that are at conferences, and all the talks are about pop health and AI and automation. 5 years ago, you went to MedTrade, there was one talk about pop health and maybe one talk about automation. Now it's every talk, everywhere you go. And so I think we're just kind of seeing the momentum and the paradigm shift in the industry of technology has to be the way you solve problems.
Yep, absolutely. And Zach, while you were talking about people, I was just thinking about the conference that you have. I just want to touch on a little bit about that. So tell us a little bit about the Smoky Mountain Symposium, what you guys are doing, how people can learn about it. I think some of our listeners would get a tremendous amount of value from it. And I think it's an awesome event that you run. So I would love to just learn a little bit more about it, and feel free to share anything and everything to help our listeners learn more about this event.
Yeah, so it's the 16th year that we put on this event, and it's also evolved over the years. But it was one of the first things that I started doing when I started doing kind of a side business. Is I started this company, Healthcare Education Systems, and we were doing conferences. And so I did conferences all over the Southeast, did some small 1-day conferences and 2-day conference. And then as I kind of evolved and went into DME and software, I got rid of all the other conferences, but I kept this one because it was the big one that we did. And so it has turned from, a small day and a half conference into a 2.5-day conference. We have about 30, 40 vendors that show up. We actually partner with Sleep Tech Podcast. I don't know if you know those guys.
Yeah, we had Robert on here a few weeks ago.
Yeah, so they're actually running our sleep track for us. So we partner with them this year for the first time. So they're providing all the speakers and helping us with vendors and kind of running the sleep side, since that's their wheelhouse. And then we're running the respiratory side, and then of course hosting the whole event. But the event is live and it's online. We usually have total of about 500 people that come, 300 or so, 350 in person, and then the rest online. And then it's become more of a home care show. So a lot of respiratory and sleep conferences that you go to get CEUs. If you go to a respiratory conference, 98% of the topics are about hospital care. So when we started this, we really wanted to be a post-acute care focused topics. So we have a couple hospital topics. Most of them are kind of how do you transition care or ventilation topics, but most of the topics are going to be sleep or DME, transitional care kind of topics of how do you manage patients coming out of the hospital. So it's really focused on the DME industry. And because of that, we have a lot of DMEs that come, and it's just a really fun event. You've never been to the Smoky Mountains, the Gatlinburg. I tell people that Gatlinburg, Pigeon Forge, it's like, if you've never been there, it's kind of like, think about redneck Vegas.
All right. I'm sold.
Let's do it.
But anyway, so it's a beautiful time because in the Smoky Mountains there, the leaves will be changing when we have the conference. We strategically have it that time because it's so beautiful. It's a great time to do Christmas shopping, all that kind of stuff. And there's just so much to do there. It's a fun little town and beautiful place. So it is in October. Our website, Encore, www.encorehc.com is the place to go and find that, as well as any other information about Encore. I was trying to find the dates because I forgot to look, but it's in mid-October, mid to late October. I'll find the dates before we get off here.
Okay, perfect. Yeah, no, that's great. I think that's going to help a lot of DME listeners right now, and hopefully we get some more people coming to the show as a result of people listening to this. And Zach, I think we could start moving on to our last and final piece of the podcast, which is what we call a rapid fire round. So if you're ready to go, it's kind of like a this or that thing that we do with every guest. We could shoot it off and we can get that going.
Yeah, let's do it. Sounds like fun.
All right. All right, let's do it. You ready? Okay. Rapid fire. Here we go. Live without coffee or live without Wi-Fi?
Without coffee.
Be able to teleport anywhere or read minds?
Read minds.
Always have to sing instead of talk or dance instead of walk?
Dance.
I like this one.
Walk. For sure.
Vegas or Redneck Vegas?
Redneck Vegas, for sure.
Be famous for one day or anonymous forever?
Anonymous forever.
Work 4 10-hour days or 5 8-hour days?
4 10s would be great.
And one last one. Free tickets to every sporting event or every concert?
Every concert.
I like that.
Yeah.
Perfect. All right, Zach, I think we're all wrapped up for today. If anyone wants to find out more about you or your company, how can they reach out to you or find more information?
So, like I said, the website, www.encorehc.com, that event, the Smoky Mountain Symposium, October 22nd through 24th, and that information's on the website, and then can email me as well. And so it's zgant@encorehc.com.
Perfect. Well, thanks so much for coming out today. We had a really good time, and hopefully we can do this again.
Yeah. Thank you guys for having me. This was a blast.
Yeah.
Awesome.
Thanks, Zach. Have a good one.
And
You
to
too.
all of our listeners, if you haven't subscribed yet to the Claim to Fame podcast, please do so. All right, Zach, talk to you soon. Thanks so much.
Thank you.